Welcome back to PT Meal Physical Therapy Podcast. Again, I am Johan de la Paz, and for today's episode, we're going to talk about pelvic floor physical therapy and what it is. So, for today, we have Lili Wells to help us understand what pelvic floor physical therapy is. Hi, welcome to the show, Lili.
Hi, Johan. How are you today?
I'm good. How are you?
It's happy Easter
Oh,
weekend.
yes, happy Easter weekend to you too.
Yeah.
So as I've mentioned, we're going to for today's episode, we're going to talk about pelvic floor physical therapy and what it is, and how physical therapists can help people in terms of their pelvic health and well, some exercises probably for them. So, but before that, I want to ask you to give us a brief background on how you got into physical therapy first, and what led you to where your current practice is now.
Okay. So my name is Lili Wells, and I've been practicing forever, for a long time. I went to the La Salle University back home in the Philippines, and um, I've been practicing for over 21 years, for 21 years. And I came here to work at the hospital setting, but I started as a traveler physical therapist.
Mm.
And my company had me work here in the Midwest, and my goal was to really to work somewhere warm. Like I wanted to be somewhere where my family is, because my family is based in California. And so I wanted to be there, but my work assignment was in the Midwest.
Mhm.
And then I work in the hospital setting, and I pretty much worked there for 20 years until recently, um, actually just last year, when I opened this outpatient clinic. And um, and it's multidisciplinary physical therapy, occupational therapy, and speech therapy services. And so it was a different kind of different, but in a way it's good because I've been doing a lot of the outpatient services at the hospital. So I've been a rehab director and overseeing all the different therapy services at the hospital. And then, so same thing in this clinic, it's also overseeing the PT, OT, and speech therapy. Um, I got my doctorate at Des Moines University, and I got my PT degree back home in the Philippines, and then I came here and I got my doctorate. And I always say there's always so much to learn.
Right.
And this is pelvic PT is just one of my specializations. I do lymphedema treatment, and I love that. I'm so passionate about it. I'm also passionate about dry needling. I've been doing
Mhm.
dry needling too. And then I just recently got my certification in assisted soft tissue mobilization, or ASTIM.
Mhm.
I just did it like a few weeks ago, like last
Mhm.
month. And then I've also been doing, oh my gosh, okay, what else am I doing? So I've done women's health, pelvic floor, dry needling, lymphedema, and ASTIM, and um, oh my gosh, what else do I do? I forgot now. Yeah. So,
Well,
anyways,
I'd like to
yeah,
have you
that's
again for lymphedema because
yes,
that's an
sure,
interesting
sure.
topic. Yeah.
Yeah, yeah,
Yeah, but
definitely.
but for today we're going to talk about pelvic floor physical therapy. So for those who are not familiar, for me it's also
Yeah,
I'm just touching on the surface into pelvic floor because I just attended one seminar just to try to
yeah,
find out what it is. But
yeah.
um, how would you describe pelvic floor physical therapy and what it is?
A lot of people will ask me, what is pelvic floor?
Mm-hmm.
And do I have one? And where is it at? So
Yeah.
there's we're just gonna talk about a little bit about pelvic floor as a whole,
Mm-hmm.
and because there's just so much information about it.
Mm-hmm.
But the thing with pelvic floor is it's just not limited to women,
Mm-hmm.
and not just limited to maybe the geriatric population or postpartum um, cases, or menopausal women.
Mm-hmm.
You can see some issues as well among men and athletes, runners,
Mm-hmm.
So when it comes to the pelvic floor, there's just a lot of information that I wish I've known before. But we're going to dive into this, and I could tell you a little bit about the beauty of it. And I even have brought, I don't have the model with me, but I have this. Can you see it?
Wow. Yeah. Yeah. Mm-hmm.
So there's your, okay, actually there's your pubic bone,
Mm-hmm.
and there's the coccyx right
Mm-hmm.
there.
So
But
it's a top view.
yeah,
Mm-hmm.
so all this red stuff,
Mm-hmm.
it's actually red if you can see it. All that red stuff is muscle.
Mm-hmm.
So from top to bottom and on the side, it's all muscles. And guess what? When it comes to muscles, physical therapy can rehabilitate it. So
Correct.
yeah, and it looks like a bowl. If you
Mm-hmm.
look at it, it looks like a bowl.
Mm-hmm.
I have another picture. I'd like showing pictures because I educate my patients about it. If you look at it, it looks like a sling.
Right. Right.
And then there's your bladder.
Mm-hmm.
This is a female one part too,
Mm-hmm.
by the way. So there's your bladder, the
Mm-hmm.
uterus, and the bowel.
Yeah. So for
So
those who are just listening and doesn't see the visual presentation, the pelvic floor muscle is a sling that connects all those organs. So
yeah,
as physical therapists, we can target and rehabilitate those muscles.
yes,
Yeah.
definitely.
Mm-hmm.
And it's definitely more supportive. So if you can imagine that sling is weak or lax,
Mm-hmm.
so what happens is it might not have the support that your uterus needs, or your bladder,
Mm-hmm.
or the bowel.
Mm-hmm.
So it's very important that we strengthen that muscle. So
Mm-hmm.
a lot of patients would say, you do pelvic floor?
Mm-hmm.
Um, why is it the physical therapist touching that area? Again, it's because it's muscles, and
Yes. Mm-hmm.
muscles have, we PT have anything to do with muscles. We touch it,
Mm-hmm.
we rehabilitate it, we educate it, we strengthen it.
Mm-hmm.
And so, and there's a lot of muscles in it too,
Mm-hmm.
and it's amazing what we can do to help people that have problems in their pelvic floor. And you know what, with that being said, these muscles we utilize every single day.
Correct.
Like
Mm-hmm.
we pee, we poop,
Mm-hmm.
and hopefully we have sex on some point.
Mm-hmm.
And you are using all these muscles that I just showed you,
Mm-hmm.
and a lot of dysfunctions can occur in, with those muscles involved. So
Mm-hmm. So right. So aside from incontinence and yeah, bowel incontinence, urinary incontinence, and sexual dysfunction, are there any other conditions that a patient would want to go
yeah.
into pelvic health physical therapist?
Yeah. So I see a lot of patients with urinary incontinence,
Mm-hmm.
whether it's a stress incontinence or urge incontinence. There's also bowel dysfunctions. People might have some sexual dysfunctions or pain.
Mm-hmm.
I can tell you a really good story. This is kind of like one of my favorite, because I had a patient who she was a cervical cancer survivor,
Mm-hmm.
and she went through chemotherapy and radiation. And then after the treatments, after the cancer treatments, um, she knew that there was a little bit of damage, and she was experiencing a lot of pain. And by the time I saw her, she said, of course, you have to take all the history and everything. the one thing that she told me is that I really just want to feel normal again and not have pain,
Mm-hmm.
because I am on the verge of having divorce. Well,
Oh.
because she said, I've been married all these years, and my husband and I have been together for many years since high school, and I have not been able to tolerate um, if we make love, just because
Mm-hmm.
it's so painful.
Mm-hmm.
So, you know what? One treatment of physical therapy, she called me the next day and she was just like flabbergasted. She just like, I cannot believe I should have known this.
Oh
I should
wow.
have seen you before. I should have had the talk with my doctor about this, or maybe my doctor should have referred me to you, because you just saved my marriage. Because when they're in so much pain,
Mm-hmm.
you try to avoid activities that might be causing more of the pain.
Right.
And then as soon as she had the physical therapy and noted relief, it was just like night and day. It was just
Mm-hmm.
like, and her husband actually came even to the therapy session and was just so thankful, because you know what? It totally changed their lives. So anyway, that was my success story.
That's nice. That's a good
Yeah,
story because
yeah,
a lot
yeah.
of I think there's a lot of women out there who's probably suffering from pain, which they don't know how to address, or they would just
Right.
address using medication.
Right. And that's
Oh.
the thing. She's been through chemo and radiation. It's like, I'm not a pill popper. I'd rather do natural stuff. Do I just need to learn exercise? What do I need to do to address
Mm-hmm.
these things? So I also mentioned about postpartum issues, sexual dysfunction, pain during sex, pain after sex, cancer recovery, especially among men. This is very huge among men with after prostate cancer, and there's research studies out there that says that men who participate in pelvic floor therapy um, benefit um, prior to having the surgery. So,
Mm.
they learn how to strengthen their muscles, and by the time they've had their prostate cancer surgery or chemotherapy and radiation, their outcomes are definitely much better.
All
So,
right. That's nice.
yeah.
Yeah. The first or pelvic floor health physical therapy was a men's health course because
Oh,
most of the
yes.
patients that was asking me about incontinence was men. So it really opened up my eyes to the
Yeah.
vast what do you call
Yeah.
this scope of
Yeah.
pelvic floor,
Yeah.
and you have also women's and then you have men's issues. So
Mm-hmm.
aside
Mm-hmm.
from what do you call the incontinence, there's also erectile dysfunction, and
Right.
you mentioned pain. So it was a very educational seminar. So
Right. Yeah. And then, of course, some of these male patients might prefer to have a male therapist. They're like,
Mhm,
but I've had male patients, and then most of them are elderly
mhm,
patients, because they've had difficulty with after having prostate surgery or prostate cancer. And you know what? They just need help. They just want to be able to live normally. Like, they sometimes will say, I'm getting tired wearing the pants.
mhm.
You
Right.
know, I don't want to wear it, or it's embarrassing if I'm in public. How
Mhm.
can you help me? You know.
Right, right. So, but I think even at this time, there's not much physical therapists who are aware of
Mhm.
what we can do as professionals in the pelvic floor realm. Um, some people would say, "Oh, it's just pelvic floor is just about Kegels." So for you, how would you,
Yeah.
yeah, how would you
Yeah.
describe our role as physical therapists
Yeah.
in the pelvic floor scene?
Okay, so when I see my patients,
Mm-hmm.
that's the one thing that I'm so surprised that not a lot of people actually know how to do Kegels. And
Mm-hmm.
it's like, are you doing it properly? How can you, excuse me, how long can you hold the muscle contraction? Can you actually relax your muscles? Because some, kind of like when you're working on your computer, on your laptop, you have this very tight muscle here. And we see that in the pelvic floor too. People might not know that they have weak muscles, but some people have very, very tight muscles. It's like always contracted. It's like, how can you relax it? So it goes both ways. So for physical therapy, when they come, there's so much education. And when I'm assessing them, it's not just I'm looking. There's two types of assessment when you do pelvic floor therapy. You do the external and you do internal. So the external, you check their posture, you check their muscle strength, your range of motion. You check their hips, their shoulders, their lumbar, their thoracic, their core muscles. And sometimes people would say, really? That's even, you have to check my shoulder too? Yes, I do. Like you check the ribs, the breathing, and all those, how they're walking, what activities do they do most of the time, what are the activities that seem to aggravate their condition. So all that. It's kind of like your daily assessment when you see a geriatric patient, so you do all those testing. And then, of course, that's after you've done all the prior medical history. And I tell them, tell me everything that you want me to know. So that's a part of your subjective part. So you do the external testing, and then you also do the internal testing. But before I go to the internal testing,
which is the interesting, the most interesting part of pelvic. Yeah.
I know. So for physical therapy, of course, we teach them exercises, and we want to make sure, okay, are you doing the Kegels properly? Because if they're not doing it right, you know what? It's not really working on the right muscles. So they have to be instructed on how to properly do it. Aside from that, you teach your patients some of the dietary training or behavioral training, like what are the things that you're probably eating that might be irritating the bladder, that might be contributing to why you're always going to the bathroom, the urgency and the frequency. And then the other thing too is, what are the medications that you're taking? Like, I'm sure you have patients that are on Lasix or taking some other pill. Yeah. And you know what they have found that that could contribute to the urgency. It's either whether they're drinking enough water or they're not drinking enough water. Or some of these patients, they're just afraid to drink at all because they don't want to go to the bathroom, because they know once they laugh, cough or sneeze, or when they get up from the chair from sitting for too long, or even if they're standing, they have to go to the bathroom because they don't have the control.
I agree.
So medications is one thing. And then aside from the exercises and a lot of behavioral treatment, I teach them about bladder retraining. So I don't know if you've heard about the bladder retraining, where you teach them to log in, like the time they have to go to the bathroom, how frequent it is. Did you have a big leakage, or is it a medium, or just a small amount? Is it just trickling down? What activity have you been doing? Did you just like walk by? Were you just walking, or did you just hear the faucet dripping, or were you on your way to the bathroom, or were you just driving, or did you just cough or sneeze or laugh or jump? So a lot of those things that you have to document and teach the patient how to do it. Other thing I do is biofeedback. So I use the machine, this biofeedback. It could be a handheld one, or you can have the fancy one where you attach it to a software in your computer. And you can watch and tell your patient, okay, contract your muscle. And then you can see the graph spike. And then you say, okay, now relax. And then you see that graph go down. And sometimes patient won't be able to even, contract the muscle, or they don't see that graph go up,
Mm-hmm.
or sometimes they can't even have it go down because they can't relax their muscles. So it's just one way, visually and auditory way of re-educating your patients. So um, a lot of education, really, a lot
Right.
of education to your patients. So
Mm-hmm.
so now do you want to hear about the internal check?
Yes, I'm sure everyone's excited to hear that.
So the internal, a lot of therapists probably would think it's like, oh, I don't want to do pelvic health because I don't want to do internal check. So
Yeah, because when I attended the male pelvic floors seminar, there were a lot of female participants,
yeah,
and
yeah,
I was expecting a lot of male participants, but
right.
there was a lot of female participants, and it was just four of us male participants.
Oh,
So
good.
basically, we were the subjects.
Oh, yeah,
So yeah,
yeah.
so
It's like,
all right, so I'll let you go on. Okay.
well, when I went to my certification class, there were no male therapists. There were no male, all women.
Mhm.
So, okay, so the internal check. When I see my patient, I break your pelvic floor into layers. It's like oftentimes we refer it to like your pelvic muscles like an onion. So there's layers and layers and multiple layers that have different functions. So there's three functions in your pelvic floor. They call it the 3S: sexual, sphincteric, and supportive.
What's the second one?
It's called sphincteric.
Okay,
It's
sphincter.
sphincteric.
Sphincter. Yeah.
Yeah. So sexual will be for sexual appreciation and orgasm.
Mm-hmm.
And then the sphincteric is in nature. Um, it's like a sphincter. It opens and closes
Closes. Mm-hmm.
to allow for urination and defecation.
Mm-hmm.
And supportive, because that's the third layer. It's supportive because it supports your uterus, your bladder, your cervix, the your vagina. But then for the male, it's for your bladder and your rectum support. So 3 S's. So what I do when I do internal check, there is a one, we call the 1-digit assessment. So either I
Just to clarify that to those listeners, digital meaning one finger.
one finger, one
Because
finger.
when I read that, okay, digital, okay, so it's high tech, it's digital. But later I found out, oh, finger. That's the digital part. Okay,
Yeah.
all right.
So either I go through the vaginal or the rectum.
Mhm.
So you palpate all the muscles of the pelvic floor, and there's so many muscles in the pelvic floor. You have superficial, middle layer, and deep layer. Also including 2 hip muscles as you go deep into the deepest layer of the pelvic floor. So what I do is I touch each muscle and I'm checking for pain, and I assess, can you feel this? So you're checking for sensation. You ask the patient, can you feel this? How about this one? Can you feel I'm putting pressure on it? Is it tender? So at the same time, you also ask the patient, can you contract your muscle? Can you do the Kegel? Can you squeeze? So you do your manual muscle testing that way. So an example is, okay, this is my finger. So 0 manual muscle testing is if I cannot feel any contraction. So grade one will be like a very, very light touch. 2 will be like, oh, okay, I can feel a little bit like the muscle is wrapping my finger.
Mhm.
Grade 3 is like, oh, that's a very good like wrap, like around my finger. 4 will be, there's a little bit of a pull. And a grade 5 will be like you're tugging my finger.
Okay.
So there's your manual muscle testing.
Mhm.
So you ask the patient, can you squeeze your pelvic floor muscle? And the way I describe it to my patient is, can you hold your pee?
Mhm.
imagine you have to go to the bathroom, but you're not close to the bathroom. So try to hold your pee. Or sometimes my patients like, I don't know how to do that. They don't know. I mean, I don't know where my pelvic floor muscle is. Or sometimes you ask your patient, okay, just imagine you're gonna pass gas
Mm-hmm.
or you're gonna fart
Uh-huh.
and you have to hold it. So try that. And then when they do that, so those are the two main instructions, like trying to hold your pee or try not to pass gas. And once they do that, they contract their pelvic floor muscles. And you'll be surprised sometimes. I've had many patients who have 0 grade. I
Wow.
just can't, yeah, there's no muscle contraction. It's either they've had some nerve damage from
Mm-hmm.
surgery or from cancer treatments, or they just have that poor awareness,
Mm-hmm.
like
Mm-hmm.
I don't know how to do it. So what they do, they
Uh,
contract their buttock muscles, their gluteal muscles, they
uh-huh.
squeeze their, and I tell them, no, 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 that's cheating. You can't
Uh,
squeeze your buttock muscles. Or sometimes they move their hips or lift their buttocks, or they use their core muscles, like they like hold their breath.
mm-hmm.
So yeah, and so again, you have to teach them. It's like, okay, I'm going to teach you how to properly contract your pelvic floor muscles. And guess what? Research out there has shown that 30% of the people don't know how to perform their Kegels.
It's easy to say, but it really, for some, it's really hard to do.
Yeah,
Mm-hmm.
yeah. So that's the internal check. It can be a little awkward for some, but you know what? It boils down to educating your patient.
Mm-hmm.
Tell them what to expect, and then and most of these patients come needing help,
Mm-hmm.
and there's just so happy once you know you help them.
Right. So, the internal check sometimes can be a form of treatment as well, right?
Oh
Yeah.
yes,
Uh-huh.
definitely.
Mm-hmm.
Yeah. Like if you have a patient that would say, I have pelvic pain,
Mm-hmm.
what can I do to help with it?
Mm-hmm.
So it's actually one of my favorites. Treatment is when they have pelvic pain, I do this. It's kind of like how if you have like a knot here
Mm-hmm.
on your neck,
Mm-hmm.
and sometimes you kind of just massage it
Mm-hmm.
and you put pressure on it,
Mm-hmm.
and sometimes you hold it for 60 to 90 seconds.
Mm-hmm.
And then after 60 to 90 seconds, it feels, oh, wow, it feels
Uh-huh.
much better. And okay, keep doing that. Do that again because you miss
Mm-hmm.
a spot. Try this
Right.
one.
Uh-huh.
So same thing with pelvic floor pain.
Mm-hmm.
You can actually put pressure. It's kind of like positional release technique,
Mm-hmm.
where you just put pressure on that muscle where it's
Mm-hmm.
tender
Mm-hmm.
and hold it for 90 seconds.
Gotcha.
And you know what? The good thing about it is it's immediate, and the patient can actually say, whoa,
Mm-hmm.
it's not tender anymore. It feels
Mm-hmm.
great. It
Mm-hmm.
feels good. I do that, and then sometimes I do a sweep.
Mm-hmm.
So I sweep back and forth and just kind of like you know how sometimes you feel like you want to massage a muscle,
Right.
and then just and it just relaxes.
Mm-hmm.
So yeah, that's right. I mean, your internal check can be your treatment as well.
Yeah, for patients who were complaining of pain, how would you approach someone who has apprehension in
Oh
an
yeah,
internal check or an internal treatment? How do you make them relax?
yeah. I usually start with breathing exercises
Mm-hmm.
because their breathing is very important, and um I don't go into the internal check unless the patient wants me to.
Right.
I have to have their consent.
Correct.
And I actually have them sign
Mm-hmm.
um, written consent that is it okay that I do this?
Mm-hmm.
Because if they don't, I don't force them to. And but I have to tell them that this is part of the evaluation, and treatments. So this is something that um, I'd like to do so that I'll be able to help you more. So I know what's really going on.
Right.
Because it's hard. Like you can just go by their prior medical history or their subjective complaint, and you can just go by your external assessment, but then it doesn't quite touch that pelvic floor area itself.
Mm-hmm.
So we do some breathing exercises. Sometimes we do some, what do you call it? Mindfulness exercises. So just for them to relax and have that awareness of maybe I'm holding my breath
Right.
and I'm tensing up, and a lot of this patient could also have some history of um I haven't had this, but this is something that's a little bit, a little bit um
Sensitive.
sensitive. Thank you. Like if they disclose that they've had history of sexual trauma,
Mm-hmm.
So you have to be really respectful of your patients, and or patients that might just have difficulty with touch,
Mm-hmm. Mm-hmm.
so yeah.
Mm-hmm. Right. So for you mentioned patients who might have issues with touching, would you also start with the patient being familiar with how you're touching, like you're assessing externally,
Yeah,
then
yeah,
ask if at that point would be okay to uh, perform the internal, or you would wait for another session to
yeah.
hold it off
Well,
to
yeah,
and
you can break it down. You can have the first part of your treatment, like we can just touch on this area, and then maybe on your second treatment,
Mhm.
after you've noticed some improvement, sometimes they would say, okay, excuse me, I'll do it on the
Mhm.
next.
Mhm.
um and the other thing too, forgot what I was gonna say. There's also devices that
Mhm.
you can use
Mhm.
so that um, if 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 they feel like maybe I could just use this equipment
Mhm.
and do it myself, then I'll probably feel better.
Mhm.
I haven't had a patient say that, but um, sometimes we use a dilator,
Mhm.
and then you can just buy it on Amazon, you can buy it online, you can buy it at the pharmacy, and then they can use that too, and they can do their own treatment at home. So
Mhm.
you give them some home exercise program, and you just instruct them, this is how you can do it.
Mhm.
So
Oh, that's nice. So there's a
yeah.
follow up at home as well.
Right. Yeah.
Mhm.
So there's different sizes of dilator. You can start with a very small one and then work it up.
Mhm.
Um, and again, it you can use the smallest one for a week until you feel comfortable.
Mhm.
And some of the patients will be like asking me, is like, "You mean a sex toy?"
Exactly. Yeah. But
A
you would
sex
you would say
toy?
that in a would you say that in a straight face? No, it's a dilator.
Yeah, right. Yeah. So I mean, uh, again, it boils down to educating your patients, because patients, most of my patients, of course, they're just like, I'm here because I need help,
Mhm.
and if you can help me, great, because I've been having this issue, this problem for years, or it's been, most of them are chronic.
Mhm.
And you could just understand some of them probably don't want to see a physical therapist
Right.
because it's something like, I'm not comfortable, you
Mhm.
know but once they get relief, it's amazing.
Mhm.
You
Right.
feel so fulfilled that
And
way.
also, I guess some doctors are not aware that as physical therapists, we can also touch on those uh, issues with patients. So
Hmm.
yeah, it's also a way that we can address the patient's concerns as well.
Yeah. Yeah. Honestly, I get most of my referrals from OBGYNs,
That's good.
OB-GYNs.
Mm-hmm.
Um, and then after I started practicing and
Mm-hmm.
working on pelvic floor and women's health,
Mm-hmm.
it's like educating the other doctors as well and say, hey,
Mm-hmm.
we can do this, we can help
Right.
your patient. And they'll be calling you, it's like, can you do this, can you help
Mm-hmm.
us with this,
Mm-hmm.
I have this patient like this. And it's like, yeah,
Mm-hmm. Mm-hmm.
yeah. And it's like educating them because they didn't know that we can do it.
So
So
for you, what was your what do you call this, light bulb moment when you decided to go to touch on to pelvic floor physical therapy?
pelvic floor,
Yeah,
um the light bulb moment,
like
it was actually one, yeah, it was one of the OBGYN.
mm-hmm.
And she's like, Lily, I have so many patients that I could refer to you. And I think it will be great if there's somebody in the department who is certified in seeing pelvic health patients.
Mm-hmm.
And that was the light bulb moment for me, because it's like, I guess there's a need
Mm-hmm.
in the
Mm-hmm.
community. It's like, why are you sending these patients to drive an hour away to
Mm-hmm.
see a, a physical therapist that specialize in it when we can offer it here, you
Right.
know?
Mm-hmm.
And honestly, in my team, I have, um, I think there's 50% women, and I have some male therapists too. And none of my male therapists would like to do it. There's like, no, you guys do that.
Yeah.
And then, I did it because one of my therapists just had a baby.
Mm-hmm.
So she was like, well, I wish I have time to go to a class, and so I could understand. And the other one was more into orthopedic cases, and that's kind of like her passion. And
Uh-huh.
so I guess I'm like, I guess I'm it. I'm the
Mm-hmm.
one. Yeah.
Mm-hmm.
So, and
Well,
I enjoy it.
mm-hmm. Yeah, for me, since I am more of a geriatric physical therapist, I had a lot of concerns with my patients regarding incontinence. That's why I was curious about pelvic floor physical therapy. So I think you can mesh your specialties together. Like in the seminar that I
Yes.
attended, they are mostly orthopedic physical therapists that
Yeah.
are focusing on like chronic pain, and one of
Right.
those that they want to address is pelvic floor. So I think
Hmm.
they can mesh it down. Yeah.
Yeah, and this is the other thing that surprised me.
Mm-hmm.
Some of my patients that have low back pain,
Mm-hmm.
you assess their lumbar spine, they check their hip, maybe their gait pattern, and you know what? Sometimes it's actually coming from the pelvic floor.
Oh wow, wow, that's
Hmm.
interesting.
Yeah.
Mm-hmm.
So I one of the other things that I ask my patient is, can you show me how you lift? Can you show me how you squat down?
Mm-hmm.
um, and I always ask, do you have leakage, do you have episodes where when you're jumping, do you have leakage? Or some of the runners,
Mm-hmm.
if
Exactly.
they
Mm-hmm.
run marathon,
Mm-hmm.
and then are you putting more damage to those muscles? And I've seen this among CrossFit, um, weightlifting activities, that sometimes people may overdo, um, and then they notice, it's like, oh, wow, I'm
Mm-hmm.
having some urinary incontinence.
Mm-hmm.
So are they putting more damage to their muscles, or is are you helping it? Are you working on your core muscles? You have to integrate all that.
Mm-hmm. Yeah, so it's more of global. So you can't separate pelvic floor from other issues, right? Yeah, because I
Right.
think for like you mentioned, CrossFitters, running athletes, and
Yeah.
aging population, they would think that those leakage would be normal, but in
Right.
fact, there are some underlying issues that we can, as physical therapists,
Right.
address. Yeah,
Yeah.
nice.
Yeah. And the other population I've seen are among menopausal women,
Mm-hmm.
like because the female hormone estrogen, um, that could also affect the pelvic floor muscle because it's thinning the tissue.
Mm-hmm.
So then they start saying, "Oh, I was just laughing, or I
Mm-hmm.
just cough or
Mm-hmm.
sneeze,
Mm-hmm.
and I noticed like I'm having this leakage." So
Mm-hmm.
yeah.
And you mentioned in our discussion that something about the fourth trimester. What's that?
Yes. So, you know, after giving birth, a lot of the patients would say, "When can I go back to work?
Mm-hmm.
Can I start running after 6 weeks? Can I do this at home? Can I while taking care of the baby or my family?" So the fourth trimester is people. Oh, I mean, OBGYNs will ask this question now, and they're asking more thorough questions. Is like, are you having pain?
Mm-hmm.
Is the wound where you had the episiotomy, where they do the cut, is it healing well? Are you bleeding? Are you having difficulty with your daily activities? So the fourth trimester is just having all these healthcare providers, including physical therapists and OBGYN, asking the patient postpartum is like, what are the issues that you're having? And considering like maybe you need to do some strengthening before you can go back to work. Like for us as physical therapists, we do lifting. We have to transfer our patients and or we have to help them during gait training. But if you have weak muscles and you have the symptoms or pain, maybe we need to address that first and restrict you on some of the activities before you go back to work. So the fourth trimester is just like that time where we just have to consider things before having the patients go back to their previous level of activity.
So it's like the
Yeah,
transition period for them. Hmm. Right.
yeah, yeah. Yeah, it's so hard because especially in America, we're just always on the go.
Mm-hmm. Exactly.
It's like if you had knee replacement, you can't expect to be driving in a week,
Mm-hmm.
especially if it is on the right knee
Mm-hmm.
surgery. You have to have some recovery time.
Right.
So same thing with if you had abdominal surgery or pelvic surgery, you have to allow some healing time. So
Hmm.
that's what it is.
Right. And that's good. We've touched on a lot of topics with pelvic health, and I had a lot of like I took notes of what you were saying. Yeah.
Yeah.
So for you, what's the beauty of uh being a pelvic floor physical therapist? What do you like about it?
It's the beauty of being a pelvic floor physical therapist is education
Mm-hmm.
and empowering your patient um, that they can do functional activities that they weren't able to do because of some of the dysfunctions they've had in their pelvic floor. So definitely that education, I spent so much time giving them a lot of information that they could um, do at home.
Mm-hmm.
And I usually just see my patients once a week.
Mm-hmm.
And then I will probably just see them for, I don't know, it kind of ranges anywhere between 4 to 8 visits.
Mm-hmm.
So after 4 visits, if I've seen so much progress and they've met their goals, you're done.
Mm-hmm.
I've had patients who've had chronic pain or chronic conditions, and they might need more visit after the eighth mark.
Mm-hmm.
But most of my patients, I just see them once a week for 4 to 8 visits. Most of them just need 4,
Mm-hmm.
and a lot of it is educating and
Wow.
empowering them. So I
Mm-hmm.
think that's the beauty of it. It's just you do a lot of that to your patients.
Right. And one thing that um, was shared to me by one of the people in the seminar that I attended. She said she was working in an outpatient facility, which is like
Yeah.
you're handling two patients at a time, right? But when she was assigned to pelvic floor physical therapy, she loved it because it had more intimate time. It's one on one. You're not rushing your patient. You're spending your time getting to know the patient, the history, and all the assessment.
Yeah.
You're very thorough. So she loved that
Yeah.
one
You
on one.
know, yeah, definitely one on one. You don't want a,
Yeah.
you really need a private room.
Mhm.
And I usually schedule my pelvic floor evaluation for between 60 minutes to 90 minutes.
Mhm.
And you know what? Sometimes I feel like I'm not done. I have more to share.
Exactly.
So, and patients are just like, oh my gosh, there's, I didn't realize it, that
Mhm.
there's just so much. They always go home with so much information.
Correct.
Hmm.
And because we have a lot to give in terms of pelvic floor, because not much patients or people know about addressing or issues about the pelvic floor.
Hmm. Hmm.
So
Yeah.
for physical therapists who are interested in going to the pelvic floor physical therapy scene, what should they expect and what traits should they
Oh my.
bring?
Yeah. Yeah.
Mhm.
Yeah. One thing, you really have to have an open mind, because like what I said, with your assessment, you're going to do external assessment and internal assessment. um, if you feel like you're not comfortable with that, um, you know it might not be the area for you.
Right.
But we, like what I said, you see it across the lifespan. You will see young people needing it, benefiting from pelvic floor, and you will see patients that are elderly patients, and they might be saying, you know what, I wear depends or pad 8 a day, and then at night I have to wear one because I
Mm,
can't go to bed without it. So um it you have to be patient, because some of your patients might have chronic pain and or chronic condition. And this is the other thing I forgot to mention, is that some patient might actually need to have surgery,
mhm,
but you you are not going to lose anything from coming to physical therapy, because you're going to educate them how can you strengthen your muscle before you have the surgery, because
mhm,
your outcome will be much better after the surgery. I mentioned earlier about the patient that have zero muscle testing. It's
mhm.
like, I don't feel anything at all. Are you squeezing? And she's like, my patient will be like, yeah, I'm really working on it, but I cannot feel anything. At the very least, you can teach them. I want you to try this at home. Do this exercise every day, 50 times a day. But you are not going to lose anything from coming to physical therapy, even if you end up having to have surgery. So you have to be patient as well. You have to be open minded. And then you have to be fun, because it can be sometimes you might feel like, oh, this is something like serious or something. But you know what? Whenever I'm treating my patients, we just sometimes it can be a sensitive area, you respect that, but sometimes you just end up laughing because you're like, I can't believe you're teaching me this, my husband doesn't even know about these things. But yeah, just have fun with it as well, and respect your patients.
Okay.
So
Being open-minded, being patient, and having fun as well.
yeah,
But yeah,
yeah.
so well, thank you for the time. I have my three last questions for you. So if you're not in your current field of practice right now as a
Uh-huh.
physical therapist, um, where do you think you would be?
Well, so my mom has always discouraged me to go to nursing school. She's a
Mm.
nurse. My
Oh.
mom's a nurse.
Mm-hmm.
And she said, "Don't go to nursing school. I'm not gonna encourage that just
Mm-hmm.
because she said then you'll be working night shift and you probably don't want that if you have
uh,
your own family." Um, I've always wanted to be in the medical field.
mm-hmm.
So I if I were a physical therapist, I would probably have gone to nursing school.
Oh, so you're really
Yeah,
interested in helping people.
right. I think
Mm-hmm.
that's my I call it my dharma. Is like, you know, my sound like okay, yeah, you do need you help people, but that's definitely what my dharma is to
Mm.
help when it comes to helping, it's something to do with healing. So
Healing, right?
yeah, yeah.
And second question, what do you suggest should all physical therapists possess in order to succeed in their practice?
You have to really have this thirst
Mm-hmm.
for learning.
Mm-hmm.
There is so much to learn. And, I've been practicing for 21 years, and I could tell you that the learning process is endless. There's always so much to learn. Even when I went to my doctor of physical therapy, I didn't realize, oh my God, why am I back to school? I'm done with learning. I'm done with homework. I'm done with, all these things. And there's just so much to learn. And because you know what? There's so much to offer to your patients. And the fulfillment, the feeling, the sense of fulfillment once you're able to help, it's just wonderful. It feels good.
Mm-hmm.
So if you have that thirst for learning, just go for it because you want to be able to give back to your community. I've been here for many years, and it's just able to help them and tell them, yeah, I can do it. I can help you. I know how to do it. It's just that sense of fulfillment that you know that you can do something for your
Mm-hmm.
patient. So learning,
Right.
always go for that.
Yeah, of course, and of course, in learning, you would give the highest quality of service you can give to the patient, and that's
Right,
yeah, being fair to them.
right.
And lastly, what are the three ingredients that uh, that are essential for you right now that you carry every day? So, what makes up Lily? So, it may be a an event, it may be a thing, a person. So, what are the things that are important or essential in your life right now that you carry every day, each and every day?
Wow. Three ingredients? Can we
Yep.
just talk about salt, pepper, and sugar or something?
So what makes up Lily?
uh,
What is true for you?
oh gosh. True for me. I think um definitely my family.
Hmm.
Yeah, family. They're your compass. They um my family has always been very supportive um of everything with my career especially, and um all the things I've done when it comes to my career. It's my family that has been always there and supportive of me. So that's very essential. And I probably wouldn't be here if, I probably wouldn't be doing this if I didn't have their support. So they're definitely my compass. That's one. So
That's
two
one.
more.
Two
Two
more.
more. Okay. Of course, faith.
Mm-hmm.
Your faith, and um, and tomorrow's Easter. It's kind of
Right.
weird
Mm-hmm.
that we won't be able to go to church
Uh-huh.
physically, but
Different now.
yeah, it's kind of like, anyways, it's strange. But faith is one thing because there's definitely a lot of uncertainties, and this is definitely a difficult time
Mm-hmm.
for many of us, and so just keeping that faith. um Third, you want another one, another ingredient?
Last one.
One more, okay.
Oh, well, we can stop at that if you'd like.
I can't think of any.
So
I
that's all
guess my
right.
health. Yeah, my health. I guess
Oh,
just keeping healthy, um taking care of yourself, maybe doing more self-love
mhm,
and being more inward, especially during this time.
mhm.
So, yeah.
So family, faith, and health. Those are the three things important for Lily right now.
Yeah.
Yeah. So, lastly, but again, I want to thank you for giving your time, sharing your experience and your knowledge with us. I have learned a lot. I sure did write a lot of stuff here, and I am excited to get into pelvic floor physical therapy as well. So, as a closing, what do you want our audience to take away from this episode?
Um, that pelvic physical therapy is one area um, that will be worth looking into. And like what I said, have an open mind, be patient. There's so much information about pelvic floor. You can help people that um, across the lifespan, and male or female, and it's very fulfilling. That sense of fulfillment is just wonderful and amazing once you're able to help these patients. So consider it.
Yeah, right. Good words. All right. Again, thank you. Thank you, Lily, for
Thank
your
you.
time.
Thank
All
you.
right.
Thank you, Johan.
All right.
And stay safe and happy Easter.